Imagine waking up and realizing that the world around you has lost its brightness. Colors that once jumped out at your eyes now seem faded, and reading a book or recognizing familiar faces has become a challenging task. For many people with diabetes, this isn't a simple metaphor. It's the painful reality of living with preventable eye complications. The silent thief of vision. Diabetes is known as a treacherous condition, which acts quietly while you are busy with everyday life. Among the numerous damages it can cause, the eyes occupy a position of alarming vulnerability. Diabetic retinopathy, for example, occurs when high blood sugar levels damage the blood vessels in the retina, the part of the eye responsible for picking up light and turning it into images. But this is not the only danger. People with diabetes also face a higher risk of developing glaucoma, which increases pressure in the eyes and can damage the optic nerve, and cataracts, which make vision blurred due to premature aging of the lens. Why does diabetes affect vision? Uncontrolled diabetes causes blood sugar levels to rise, and this can damage the small blood vessels in the retina, the part of the eye responsible for capturing light and creating images. Over time, such damage can lead to partial or complete loss of vision. It's like a storm that starts slowly, but can leave a devastating trail. But that's not all. High glucose levels also alter the fluid inside the eyes, making it difficult to focus. This is why many people with diabetes feel their vision fluctuate, becoming sharp one day and blurry the next. The warning signs. Blurred vision, as if you are looking through a dirty window. Difficulty seeing at night, especially while driving. Dark spots or dots in the field of view, resembling shadows or flying flies. Feeling of pressure in the eyes or pain, which can be confused with tiredness. Frequent changes in the degree of glasses, which indicate eye instability. How does diabetes affect different parts of the eyes? In addition to the retina, other eye structures can be compromised by diabetes. Let's understand the main conditions. Diabetic retinopathy. Diabetic retinopathy is the most common eye complication of diabetes. The condition occurs in stages. Non-proliferative. Small blood vessels in the retina are damaged, forming microaneurysms that can leak fluid or blood, causing swelling. This can lead to macular edema, which directly affects central vision. Proliferative. In the advanced stages, new abnormal vessels grow in the retina. These vessels are fragile and can rupture, causing vitreous hemorrhages. The resulting scarring can lead to retinal detachment and severe vision loss. Cataract. Excess sugar in the blood can modify the proteins in the lens, the natural lens of the eye. This accelerates the formation of cataracts, making vision blurred and blurry. Glaucoma. Diabetes increases the risk of glaucoma, a condition in which intraocular pressure rises, damaging the optic nerve. This can occur gradually, impairing peripheral vision until it results in blindness. Optic neuropathy. High glucose levels can affect the nerves that control the eyes, causing difficulty with eye movement and double vision. The impact of glucose on eye fluids. High glucose affects the vitreous humor and lens, modifying its shape and elasticity. This instability causes visual fluctuations, which often confuse patients, since they are not always directly related to the retina. Prevention and control. Although diabetes poses serious risks to vision, steps can be taken to protect the eyes. Strict glycemic control. Keeping blood glucose levels stable significantly reduces the risk of complications. Regular ophthalmic checkups. Performing fundus examinations allows early detection of retinopathy and other changes. Blood pressure and cholesterol monitoring. These conditions aggravate the damage caused by diabetes. Healthy lifestyle. A balanced diet and physical exercise help control blood glucose. Prevention and care that makes all the difference. Taking care of eye health goes beyond avoiding complications of diabetes. It is to ensure quality of life in the long term. See how small changes can have big impacts. Strict blood sugar control. Keeping blood glucose within proper limits is essential to prevent damage to the eyes and other organs. In addition to daily monitoring, consider balanced diet. Prefer foods rich in fiber, such as vegetables and whole grains, which help stabilize sugar levels. Fractional meals. Eating in small portions throughout the day prevents glucose spikes. Medical follow-up. Regular reviews with an endocrinologist ensure necessary adjustments to medication or insulin. Regular eye exams. Conducting preventive examinations is one of the most effective ways to protect your eyesight. Included in your routine, fundus examination identifies changes in retinal vessels even before symptoms appear. Eye pressure measurement, important to detect early signs of glaucoma. Consultation with the ophthalmologist, at least once a year, or more frequently if problems are detected. Control of blood pressure and cholesterol. Hypertension and high cholesterol potentiate the damage caused by diabetes to blood vessels. To reduce these risks, adopt a healthy diet. Limit the consumption of saturated fats and salt. Monitor regularly. Track your blood pressure and cholesterol levels. Medicines. Strictly follow the medical guidelines in case of using medicines. Give up smoking. Smoking is one of the biggest enemies of eye health, especially for those with diabetes. Nicotine impairs blood flow, accelerating damage to the vessels of the eyes. To facilitate the process, nicotine replacement therapies, patches or gum can reduce withdrawal symptoms. Psychological support. Talking to specialists and support groups can make all the difference. Practice regular physical activity. Physical exercise not only helps with blood glucose control, it also improves circulation and reduces stress on blood vessels. Some simple options include daily walks. A 30-minute walking routine can positively impact health. Low-impact activities, such as swimming or yoga, for those with physical limitations. Consistency. The important thing is not intensity, but maintaining a regular practice. Add these practices to your daily life. Small cares become powerful allies against the damage of diabetes. A preventive approach not only protects vision, but improves overall well-being. Remember, your health is in your hands, and smart choices today ensure a brighter tomorrow. The role of the optic nerve and ocular circulation. Diabetes doesn't just affect the blood vessels in the retina. It can also cause diabetic optic neuropathy. The optic nerve is like the fiber optic cable of your eyes, transmitting the images you see to the brain. If the blood supply to this nerve is compromised due to high glucose levels, it can suffer irreversible damage, leading to partial or complete loss of vision. In addition, diabetes can cause a condition called macular edema, which occurs when damaged blood vessels leak fluid into the macula, the part of the eye responsible for central vision and detail. Macular edema can make simple activities, such as reading or recognizing faces, difficult. How to protect the optic nerve and eye circulation. Practice eye exercises. Although it is little talked about, eye exercises can help improve eye blood flow. Simple movements, such as switching focus between near and far objects, can strengthen the eye muscles and relieve fatigue. Watch your diet to protect your nerves. In addition to antioxidants, as we mentioned before, include foods rich in vitamin B12, magnesium and omega-3, which help nourish the nerves and improve circulation. For example, fatty fish such as salmon and sardines, nuts and seeds such as chia and flaxseed, dark leafy vegetables such as kale and spinach. Avoid chronic stress. High levels of stress increase cortisol in the body, which can aggravate glucose levels and further impair eye circulation. Techniques such as deep breathing, meditation, or even a simple moment of silence can work wonders to reduce the impact of diabetes on the eyes. Beware of medicines. Some common remedies for diabetes or high blood pressure can cause side effects on vision. Always talk to your doctor to adjust doses or explore alternatives that are safer for your eyes. What does the future hold for us? Medicine is advancing rapidly, and new technologies, such as gene therapies and laser treatments, are emerging to protect and even restore vision in people with diabetes. For example, treatments with anti-VEGF, a medication that reduces fluid leakage into the eyes, are already saving the vision of many people with macular edema. The skin and the immune system. Impacts of diabetes. Uncontrolled diabetes doesn't just affect blood glucose levels. It can cause significant changes in the skin and weaken the immune system, leaving the body more vulnerable to infections and serious complications. Let's explore how these interactions occur and how to prevent them. Why does diabetes affect the skin and immune system? High blood glucose causes damage to blood vessels and nerves, as well as changing the body's immune response. These factors make it difficult to transport nutrients and oxygen to tissues, making the skin an easy target for problems such as infections and poor healing. Main skin problems associated with diabetes. Skin infections. High blood glucose creates an environment conducive to the proliferation of bacteria and fungi, resulting in recurrent infections. Examples include mycoses, fungal infections, especially in wet areas such as feet, groin, and armpits, boils, bacterial infections that cause painful abscesses, candida infections. Fungi such as Candida albicans can cause itching, redness, and cracking of the skin. Difficult to heal wounds. Diabetic foot. The combination of reduced circulation and nerve damage in the feet compromises wound healing. This can lead to ulcers, small lesions that develop into open wounds, deep infections, which can reach muscles and bones, amputations. In extreme cases, when the infection is not controlled. Diabetic dermopathy. This condition is characterized by brown or reddish spots, usually on the shins. Although painless, these spots reflect damage to small blood vessels, indicating circulatory problems. Diabetic lipid necrobiosis, NLD. A less common but more serious complication. NLD causes yellow or brown lesions on the skin, with raised edges and a fine texture that can easily ulcerate. Dryness and itching. Diabetes reduces sweat production, leaving the skin dry and prone to cracking, especially on the feet and hands. These cracks increase the risk of infections. The nervous system. Diabetic neuropathy. We've already talked about the optic nerve, but diabetes can affect the entire nervous system. Diabetic neuropathy is one of the most debilitating complications and appears in several forms. Peripheral neuropathy. It causes tingling pain or loss of sensation in the feet and hands. This problem can go unnoticed until a serious injury occurs, as the person does not feel pain. Autonomic neuropathy. Diabetes can also affect the nerves that control involuntary functions such as digestion, blood pressure, and even bladder function. This can cause gastric problems, such as nausea and reflux, unstable blood pressure, leading to dizziness when standing up, urinary incontinence, or difficulty emptying the bladder. Heart and kidneys. The cardiovascular and renal impact. Diabetes is a risk factor for cardiovascular and kidney diseases, which are closely connected. Heart. High glucose levels damage blood vessels and the heart, increasing the risk of myocardial infarction, heart attack, stroke, AVC. Heart failure. Kidneys. Excess blood sugar forces the kidneys to work harder to filter waste, damaging their small vessels. This can lead to diabetic nephropathy, a condition that can develop into chronic kidney failure. Oral health. Diabetes also affects the mouth significantly. Gingivitis and periodontitis. High blood sugar increases the risk of inflammation in the gums and periodontal disease, which can lead to tooth loss. Dry mouth. Reduced saliva production increases the risk of cavities and infections. The brain and mental health. Diabetes can directly impact brain functioning and emotional state. Cognitive decline and dementia. Studies show that people with diabetes have a higher risk of developing Alzheimer's or other types of dementia due to the impact of high glucose on the brain. Mental health. Daily diabetes management can be exhausting and lead to diabetes burnout, a state of chronic stress. In addition, the relationship between diabetes and depression is well documented, creating a dangerous cycle that can make treatment difficult. Digestive system and liver. Gastroparesis, a complication of autonomic neuropathy, where the emptying of the stomach is delayed, causing nausea, vomiting, and difficulty eating. Diabetic fatty liver. Diabetes increases the risk of fat accumulation in the liver, which can progress to cirrhosis if left untreated. Prevention. What you can do today. Hydrate. Staying well hydrated helps the kidneys filter out excess glucose and reduces the risk of kidney stones. Manage stress. Activities such as meditation or light walking can balance cortisol levels and improve insulin response. Comprehensive assessment. Have regular checkups with different specialists, cardiologist, endocrinologist, ophthalmologist, dentist, to monitor all body systems. Thank you for being here and taking the time to take care of yourself and your health. Believe me, every step you take towards knowledge is a valuable investment for your quality of life. Remember, your health is the most precious asset you have, and I'm here to help you protect it. Until next time, and take good care of yourself.